Ladies and gentlemen, good afternoon. Colonel Dave Trybula coming to you again from White Sands Missile Range Headquarters on Tuesday the 24th of March. Quick updates. El Paso has issued a stay-at-home, work-safe order, which is similar to the New Mexico order that was issued yesterday. New Mexico's took effect this morning. El Paso's will take effect tomorrow morning. Essentially, the provisions are very similar and exempts federal employees to be able to do the work, hence the work safe part of the order. Along those lines, I think it's important to note that gatherings in El Paso and any violations of that order are subject to a $1,000 fine. And so just want to make sure folks are aware of that. In New Mexico, as of about 2 o'clock this afternoon, reports were 83 positive cases of COVID-19, which is no change from what we talked about yesterday. Again, I wouldn't read anything into that. However, the number of negative tests that had come back were up almost 600. We did have a little more definition in terms of counties where the positive cases are reported. And so the counties surrounding Albuquerque has 38 positive cases. Santa Fe has 12. Socorro is still reporting the 2 that they did originally. Donna Ana is up to 10. In El Paso, reports are 10 positive cases, which is 4 more than what we were tracking yesterday. I told you last week we were waiting the results of 1 case that had been tested on White Sands. That case finally came back negative, and so that was good news for that individual, of course, and the folks around them. But let's talk about yesterday's positive case, and really not so much about the positive case as what happens with a positive case. And what I would say is we actually need to step back from when the case comes back positive, because testing's already been done and there's been a waiting period where the person's been in quarantine before that happens, and probably before you get to testing, there's a period of time. And so as soon as you think you've been exposed is the time to reach out to your medical provider and your supervisor, if feasible. Let them know, so that what we can do is start pre-doing what the trace is, and also isolating any potential contact and any potential spread. And so really, the second you think you've been exposed, let's start having that conversation. Bring in our public health professionals. So leadership should be reaching out to the team at McAfee to get guidance and actually define what we think is where that spread could have occurred, and make an assessment on whether or not transmission is likely to happen, and then take the actions that follow. And so based on that, you should be quarantined if we think that you are potentially positive and have come in contact, as well as anybody who's been in close contact with you since that period of time, again, subject to the advice in direction of our medical professionals. When that test comes back positive, it actually starts the formal trace process. And so there are 2 trace teams that work. One is through the public health professionals, and it gets reported to the state, and that really works 2 ways. That works to determine not only who could you have transmitted the disease to, but also where did it come from for you. In parallel, the Garrison team is also doing a trace to make sure anywhere you've been is clean, and that we're making sure that we've got the folks quarantined that should be quarantined. And so there's a little bit of redundancy there, but that's to ensure our safety and the protection of the community. I'm going to go on to questions for today. The first question is, I want to be safe and protect others. How do I get tested? And CDC guidance is that given the limited number of tests that are out there, it takes a clinical recommendation to be tested. So your medical provider needs to say, or a medical provider needs to say, that you are showing the symptoms and therefore warrant a test. And those most common symptoms are a fever of 100.4 degrees or higher with a cough or shortness of breath. If you think you're experiencing those, again, use the procedures we talked about. Please contact your medical provider and, if feasible, notify your supervisor. I do not have the authority at this point in time to test using the tests that we have at McAfee for anybody except for beneficiaries of our health clinic. And that said, we are working through how can I get more authority as far as that goes. But we still don't have the number of tests where you can just test anyone who is concerned that they might have it and is not showing symptoms. The next question for today, can we stop using CDC SHAC, not pay, and keep our place? Yes. Okay, and to do so, reach out to CDC, have the conversation. There's a form that you need to fill out to make sure that we stop billing you and that we ensure that we're only maintaining the space that we need to based on who's actually using the CDC. Next question, are people who went out of state for spring break required to self-quarantine? If you traveled overseas, yes, you need to quarantine for 14 days. If you came in contact with somebody you think had COVID-19 or a COVID hotspot, then yes, contact the medical professionals like we just talked about, and self-quarantine is warranted. If you left the state, the governor has recommended a 14-day quarantine. The next question. Our office was told that only high-risk personnel can telework, even though that is not the guidance. First of all, thank you for reaching out. You are right. That's not the guidance. And in this case, leadership has reached out and corrected the situation, which was a misunderstanding of that guidance. And the guidance is, while supporting the mission, maximize telework. And so that is what I would ask. And if you think you're in a situation where that is not being followed, have the conversation with your supervisor. And as always, I'm answering questions. And if it's a particular case as opposed to a general case, we need a name or at least an organization to actually be able to follow through with any specifics. Next question was a long question, but really comes down to what about Stallion? And for those that aren't familiar, Stallion is the garrison on the northern part of the installation in the vicinity of Socorro. And Stallion is a critical part of the WSMR community. And for now, the same measures are in place as they are across the installation. We are not taking different measures in different places. We're continuing to review those. As most folks know, we will make weather calls based on different weather conditions, and the climate can be different at Stallion than it is here, and the same is true with the spread of coronavirus and potential danger as far as that goes. At this time, Stallion is critical to support for ongoing tests. And therefore still has mission critical needs to be able to fulfill, and we are posturing to be able to take care of you, your families, and still get the mission done. The next question, is the dog park open? Yes, the dog park is open, and it's actually two dog parks. We've got a small dog park and a large dog park. And what I would say is it's open subject to the social distancing guidance that was given. And that social distancing should be for you as well as your pets, because pets can actually get coronavirus and spread it as well. And so please, use social distancing. And if folks are coming and you've been there a while, let's be good members of the community and share the resources. But that means limit your time, just like you would on the treadmill if there's a bunch of people waiting for you at the gym. Now, a few other things I want to be able to talk to. There's a lot of questions, concerns, and frankly, misunderstanding around the terms mission essential. And I will tell you that we, and I will say that includes me, have done a bad job of being clear in what terms mean. And I don't think I've used mission essential, and I've certainly tried to stay away from the term. Regardless, mission essential is a term that is in folks' position descriptions, and it's something that we have used before. And I'm going to go through two different cases and then really talk to where we are. The first case is mission essential is often used when there is a weather call. So if we have a wind advisory and we're not going to be working on a particular day, or we get snow and we say mission essential personnel only, really when we're making a weather call, we are stopping the mission. And the mission essential is really a critical infrastructure services, security, and health and safety. And it's saying we're going to suspend all other missions, and that's how mission essential is used during those times. Similarly, mission essential is used if there's a government shutdown or a furlough. And in those cases, mission work is suspended, and it's really critical infrastructure, essential services, and security that continue to go on. And that's how mission essential is used. We are in a mission and mission support status right now. We have ongoing missions, and as discussed previously, the senior leadership of the Army approved an exception to policy to enable us to bring in a few folks to enable a test to go on at the range. And at this point in time, I will share that we have that units training on the range, and that should cause very little impact or chance for folks to come into contact with that unit as they are out training really in the field on the range. There are some workers who will come in contact with them and therefore have to support. But that is part of the missions that we have going on. There are many other missions that we have not been relieved of. There are some that the test center has been relieved of and other organizations have, which allows them to be able to adjust their posture. And so we've got not only the mission organizations having to do their job of being able to provide that mission, we also have the support organizations which are critical to being able to enable those. And that's the situation that we are in right now. Could that change based on conditions? Absolutely. But right now, that's where we are. And I thank everyone for what you're doing to ensure we get the missions done, to support our warfighters and be able to support the folks that are supporting them while taking care of our families and our community. I understand that there's been a challenge for some folks in being able to view the videos because they've been posted to the Facebook page. We are adjusting that, and by tomorrow morning, if not tonight, there should be links on both the internal and external WSMR web pages, which will take you to another site that will allow you to actually access them. And that site will actually, we believe, allow you access at work on a government computer as well. That's the truth as we understand it right now. Like to talk about one of the things that happens biologically when we get scared is our vision focuses. I mean, when the adrenaline gets going, that is a biological response. And as members of this community, understanding the situation we're in right now, when I announced yesterday that we had our first positive case, it's really easy for that adrenaline to go, and the thought is, what do I have to do to preserve myself? And what I would ask is, take a few deep breaths. I do it all the time to get my heart rate back down and to get a better sense of what's going on. And one of the challenges we have is, I talked about the trace teams and those folks that are doing the work. Not only are they being pressured to do that work because they've got other responsibilities in New Mexico as well, but they're getting inundated with questions from different places. And so let's think about what we want to know versus what we need to know, and how quickly we need to know when we're reaching out and asking those, and what impact more broadly when we do something. What are we doing to take care of ourselves and our family and our community, and making sure that we're thinking of all of them as we're doing that. And so just ask that you think of that. I want questions to continue to come. If you have asked a question, and today we actually had a couple of questions which were addressed generally, that were actually answered one-on-one and then came in separately. And what I would ask is, just like I talked about, people working, the amount of preparation from leadership and everyone on the installation to be able to do this video every day is extensive. And so if your question's been answered, please take that answer. If you think it's something that the community needs to know, then please send it in, and send it in as, I know I've got the answer, but I think this is something the community needs to know. And ask you for that consideration so that we're not starting to answer the question all over again that's been answered one-on-one. So a little bit long, but I think there's a lot of questions that came out. Wanted to make sure folks understand where things are. And again, the first line of defense is good hygiene, social distancing, making sure that you are responsible for yourself and your family and taking the precautionary measures you can there, and then looking out for the community. And so thank you. Thank you for what you do, and I will be back tomorrow with our next updates. Good evening.